to my little corner of the internet. My name is Sumayyah, aka Sumi, and I am a mama first and also a full spectrum birth worker and traditional midwife. If this is your first time catching a video, I want to say welcome, welcome. Make sure you like, subscribe, and turn on those notifications. I drop videos very frequently. And if you've been here before and you're back again, I want to say thank you so much. And I hope that you can leave a comment in the comment section because I would love to hear your thoughts and just get to know who you are and hear from you. So today's topic is about 10 things you should be asking your doctor or midwife. And also we're gonna go a little bit into different birth settings and how to know which one is best for you. So first off, do you know the difference between a doctor and a midwife? Many people do not, so don't feel bad if you don't. So a doctor is someone who practices allopathic medicine. They have gone through medical school, and an OBGYN and a gynecologist particularly are rooted, the practice is rooted in pathology. Something's wrong and now we're gonna fix it, okay? The methods typically go into surgery, procedures, and prescribing medications and hormone management type of therapy. And they see birth as something that must be contained and that there's a huge chance that something can go wrong. It's imminent, around the corner, something may go wrong. And they're skilled to deal with anything that can go wrong, right? And they're also trained surgeons. An obstetrician is someone who is, by profession, a surgeon. A midwife is the oldest profession in the world outside of sex workers. And they are someone who typically is a woman who has learned through, traditionally has learned through the apprenticeship model of learning. So just following, sitting at the feet of another midwife to learn versus learning through books in school, right? It's a hands-on embodied learning practice. And they see birth as a physiological process in nature. It's something that's normal. The body does it spontaneously. The body, gets pregnant, gestates, and births on its own without needing intervention. And if needed, it's very rare. It's seen as something that is holistic as well. It's a spiritual thing, it's emotional, it's mental, and it's physical. A midwife is a skilled personnel who is able to support someone throughout many life transitions as well, not just birth. One of the biggest misconceptions. They can support in preparing the body for pregnancy or preventing pregnancy. They can support in pregnancy in getting pregnant. So some midwives do insemination services all the way through the entire pregnancy, and then managing the entire labor and birth, and all the way up to about 6 weeks of the newborn's life and beyond for the birthing person. You can see a midwife, for instance, if you want to insert or remove contraceptive methods, like an IUD, for instance, right? You can see a midwife because you've been diagnosed with PCOS or endometriosis or fibroids and you want a holistic consult and opinion about how to go about it. A midwife can perform an abortion. A midwife can perform cesarean at times in some clinical settings, right? So the skill set of a midwife is very vast. We have different types of midwives. We have nurse midwives, we have traditional midwives, certified professional midwives, direct entry midwives. There's different types, and we can do another video to explain. That's a whole nother video. It's a whole world of just trying to even unpack why there's so many types of midwives, right? But no matter what type of midwife you're choosing, and no matter the doctor, here are 10 things you absolutely should be asking them, okay? The first question is, why did you become a doctor or a midwife? You want to be mindful when you ask these questions, by the way, of their body language, their wording. Is what they're saying aligning with your values and what you desire, your intentions and what you want, what you're visualizing your care and your birth and your postpartum support to look like, right? So why did you become a midwife or a doctor? How long have you been a midwife or a doctor, and how many births have you attended? Very good questions to ask, because you want to see how much experience they have. It's important, right? So number 3, the next question is, what is your philosophy and your approach as a provider in the care that you give? You can imagine, right? This could be a very telling question, like really into the root of, are we aligned right now? The 4th question is, what is your perspective around consent-based care, client-centered care? Can you share with me a bit about your thoughts around that? Again, you can see, right? Like, oh, okay, some things might come out as they're talking, like, well, I feel like this or like that. You might go, oh, your heart opens up. That's exactly what I'm envisioning. That's exactly what I want. I didn't even know I wanted that. Yes. Or, oh, that's not quite what I'm looking for. Or, okay, this is definitely not a good fit. All right, thank you for your time. Maybe no more questions need to be asked after that one. Now, the next question, number 5, is, what is your experience with ... This is something that you should do research on and just think about the things that are like your hard nose or things that you feel concerned about and ask them about it. So what's your experience with working with people with twins if you have a twin pregnancy? It's important to ask. What is your experience with working with someone who has fibroids? Important to ask. What's your experience with supporting someone through a VBAC, a vaginal birth after cesarean? What's your experience with working with someone who's working also with a midwife, having concurrent care with a midwife, with a doula? What's your experience? So it can be like some of your birth team support setup that's personal to you, or certain health conditions. What's your experience with working with same-sex couples, whatever it is for your family and your health? You may want to inquire with them about that. The next question is the big one. Uh-oh, what do you think it is? What is your C-section rate? Very, very telling. That rate right there kind of spills the beans. It kind of lets you know if they're aligned with you or not in so many ways. They may have fluffed over some beautiful words for the client-centered care is like this. Or they may have fluffed over some words of, this is my birth philosophy. But the C-section rate will let us know exactly. Just for some context, most out-of-hospital midwives' C-section rate is less than 5%. That's to give you some context, okay? So if they tell you 30, 50, 60%, the World Health Organization suggests that for any given population of people, so that includes high risk and low risk people, the C-section rate should not be more than 15%. If theirs is above the World Health Organization's suggested rate, you may want to inquire, why is it so high? It's not motivated, therefore, by health of the birthing person and the baby. There's other incentives happening. That's something for you to talk to them about and to discover and figure out if that's in alignment with you. You may want a high C-section rate because maybe you have to have a C-section. You're choosing an elective C-section, or you have to have one because you discovered you have placenta previa. That's when the placenta is covering the cervix. So there's no way for the baby to release the body, because that's the only door. It's one way in and one way out for birth, right? In that case, you want somebody who's very skilled with C-section. And then you may ask other questions like, what is your experience with doing compassionate C-sections, gentle C-sections, right? And that again is another video. Okay, next question. Can you tell me a time when a client didn't consent to care or didn't agree with something you suggested? How did that unfold? And what did you do in that situation? This is to get at some of their attitudes, right? Some of their approaches, because you want to think about What if I don't agree with you? What if I'm like, I don't want to do that? That doesn't align with me. Because if anyone's not able to protest, to disagree in a relationship, then it is a toxic relationship. It is not a healthy dynamic. If someone can never say, no, that's not good for me. And if I do, there's consequences. There's coercion happening. There's fear-mongering happening. We need to think about this. It's very important. So really listen to how they word things, who's at the center of the conversation, how much fluff words are happening, and how does your body feel? What's coming up for you as you hear this person describe for each question, okay? Number 8. What are some tools and practices that you use if things begin to deviate from healthy and normal? This is very important because I'm gonna give you an example. I'm trying to think of one off the top of my head. Ooh, I know. You're pushing. Yeah, you made it to pushing. Congratulations. You're pushing all your might. It's been 2 hours. Very much so, depending on lots of different factors. If vitals of baby and vitals of the birthing person are normal. I've seen it plenty of times, right? What tools do you have as a provider in that situation? Are you going to tell me, let's change positions, follow your body? Or are you going to try to do a episiotomy? Vacuum, forceps, C-section. It's important for you to know this. What tools do they have? Do these tools align with the desire that you have and the vision and intention that you have for your birth experience? All right, y'all still with me? If you have not drank any water yet, drink some water because you're probably thirsty. All right, number 9. Are there any policies I should know about that will impact me making my own autonomous, sovereign decisions for my body and my baby? Ooh, so radical. But seriously, are there any policies, any type of routine care that I should know about? Like, for instance, is there a hard policy that everybody must have an IV? Maybe you're like, I don't want an IV. I can just drink water. I'm not sick. They're like, this hospital requires you to have an IV. Well, you might want to ask that question beforehand, before you got in a relationship with them, right? And just know you can fire your provider at any point in care. All right? It is very different to fire somebody at 9 centimeters than it is at 9 weeks gestation. But it's never too late for you to say, I don't want this person providing care for me anymore. Okay? Because the policy they don't want you to know about is that they must honor that. So our last question, number 10, is a couple questions put together. And really it's up to you to figure out which ones you want to use. But it's really like, how often do you perform XYZ? So it could be like episiotomy. That's when they use scissors and they cut the perineum. Say this is the vaginal canal. It's the space between the vaginal canal and the anus. They'll cut that space. I know, you probably clenched your bottom. You don't want that? You should be asking, how often do you do that? You know, I thought that was a very outdated practice, but in the last 2 clients I've had, their previous births, they've had episiotomies. I'm like, doctors are still out here doing episiotomies? Holy moly. Anyways, how often are you giving Pitocin? Because that's usually a failure to wait and not a failure to progress, okay? How often are you practicing emergency skills in non-emergent situations? For instance, giving Pitocin to a person after they have the baby, rushing, I'm gonna call it rushing the placenta coming out of the body, right? And aggressively massaging after to make sure there's no extra bleeding. That's an emergency technique, honestly, and should not be a routine practice. We want to inquire about that. What are some of your routine practices? How often are you doing this, that, and the third? But also things that align with you. How often are you allowing babies to have the full golden hour? Do you know what the golden hour is? How often are babies in your practice going to the NICU? What's your NICU rate? How often are people having to be sutured, like sewed up by you? How often are people allowed to birth in positions that are not the supine, laying on your back flat, stirrups position? These are some questions you should ask, okay? How do you feel about people eating and drinking while they're in labor? How do you feel about people building a birth support team for them, like doulas, and calling in their loved ones, family, and friends to support them? These are all some extra questions that just came to me that I'm sharing with you, and I hope you feel inspired. I hope you learned something today. I hope you walk away remembering that this is your birth, this is your body, this is your baby or babies, and you do not have to relinquish your power and your control to any provider, be it a midwife or a doctor. So very quickly, before we wrap up, let's talk a little bit about birth settings. Remember I mentioned that in the beginning? So the first birth setting I want to talk about, we all know about it, the hospital. The hospital is a very common birth setting. And 100 years ago, 99% of us were giving birth at home, and today 99% of us are giving birth in the hospital, all right? The next birth setting is the birth center. A birth center can be adjacent and connected and associated with a hospital, or freestanding, where it's a midwife who opened up a birth center and provides services in this brick and mortar place. And the last birth setting is home birth. That's in your home or in someone's home. Maybe it's your mama's home, maybe it's your neighbor's home. I don't know, maybe it's a really beautiful hotel. I've done that before, Airbnb. And people are giving birth outside of a birth center or a hospital with a midwife or without a midwife. I just like to mention that because we don't even know anymore that we have options. If you don't know you have options, then you cannot be empowered. If you're not able to make your own choice, then someone has robbed you of your autonomy. And the question is, who is it? I hope you feel more curious. Let me know in the comment sections what questions you have so I can answer them for you. And if you want me to make a video about something, I'm open to considering it. All right, y'all, until the next time, peace.